Okay, guys. Hey, we're live on YouTube. Let me get live on Facebook, and we'll get going here. Rotate your phone. You can't turn your phone while recording. Okay. I think we're live on YouTube, and looks like we're live on Facebook too. So, it's Friday afternoon. Oh, hang on. I gotta rotate this thing. Rotate. That's not the right rotation. Hang on. Hang on. I gotta fix Facebook is sideways. Okay. I may have to finish this and come back to it. Let me see. Can't turn your phone while recording. Well, this is the first. Hey, is it? Nope, it's still the wrong way. Sorry, guys, I'm trying to work this out. Okay, well, sorry, if you see me on Facebook, I'm going to jump off and fix this picture, and then I'll be right back. Sorry. Like we're live on YouTube still, I think. Sorry, guys. I'm trying to do 2 streams at once, and that's always risky. All right, let's see if we can get this going again. Okay, this looks better. Live again, not sideways. Publish now. Hey everybody on sorry, on YouTube. I'm messing around here trying to get Facebook working and it's not. Let me see. Bear with me one more second. Let's see if we can get this thing to go. Dang. Hey, there it is, maybe. Here we go. Go. Okay, I think it's working. Yay, I'm not sideways anymore. Okay, we're in business. Sorry for that. There's always something. Let me see if this is working now. Okay, so if you're jumping on Facebook, hello. If you're already on YouTube, hello. Looks like I'm not sideways anymore. Excellent. And I've got some questions popping on YouTube, so we'll just get to it. Let's see. Sonia says, hello from Toronto. Hello. Do IUI success rates decline after the 3rd time? Can you do 2 back-to-back to increase chances of fertility? No, they don't decrease. The effectiveness does not decline, so you can keep trying. There's nothing wrong with doing 1 today, 1 tomorrow, for example. You know, one thing we've learned in recent times with just fertility in general, or I should say one thing I've learned, was that actually more frequent intercourse leads to a higher chance of pregnancy. Sounds kind of obvious, but you know, one thought used to be, well, if you have intercourse every day, then it might reduce the sperm quality or quantity or whatever, and that might impair fertility. Turns out it's not true. There's good studies that show that the more frequent, like even daily is better than every other day, is better than every 1 time or whatever. So basically, yeah, you can do 2 IUIs back to back, and there's no evidence that success rates decline with subsequent cycles of IUIs specifically. So hopefully that answers your question. Hello from Idaho. We got California, Melbourne, Australia. Holy cow, that's crazy. What time is it in Melbourne, Australia, please? I'm really wondering. Let's see. Jenny says, hello on Facebook. I've heard it's not best for pregnant women to be barefoot. Why? I hate wearing shoes around my home. I don't really, let me see if I can see more of that comment. That was a whole comment. Yeah, no idea. No idea. Barefoot's fine. We made it a long time without shoes, so I think you're fine. I think if you live, in the South, in like the southern part of the United States, like North Carolina, South Carolina, in the 1800s, and your bathroom was an outdoor latrine, or an outhouse, then you had a higher risk of getting hookworm, which is a type of parasite. But I mean, nobody has an outhouse anymore, I don't think. So I wouldn't worry about it. I haven't heard of anything. I don't know. But don't worry about it. Go barefoot. It's fine. I'm fixing this because this is making my face look fat. Okay. Let's see. What do you recommend for nausea during first trimester? Is Imitrol safe? Yeah, so the most common thing that we recommend starting with is actually vitamin B6 and Unisom. And there's a video on my YouTube channel that actually goes through it in detail. So check it out. And I kind of walk through all the doses. I take you to the grocery store. I show you what to buy. I show you the dose, how many times a day, the whole shebang. It's on the YouTube channel. I think it's on that playlist called Watch These First if you're a new mom. And it's something about nausea and pregnancy. So check it out. Hey, from Italy, Island Girl. How's it going? Let's see. Hey, from North Carolina, Megan. That's crazy. All right. Giselle. Oh, wait, I missed Shayna. Hey, Shayna, you did make it finally. Congratulations. Can I have kombucha while pregnant? Yeah, I think it's fine. I mean, the amount of alcohol that is in a kombucha drink is like 0.01% or some just stupid small number. So I don't think that it's any big deal. Particularly if you just had one a day or something like that. So I personally don't think it's any problem at all. I drink one or two every day, and I just personally feel like it helps with, I have bad reflux, I have a hiatal hernia and terrible heartburn, and I have a lot less heartburn if I drink a kombucha every day. So I'll probably get some heartburn here soon because I'm drinking a coffee right now. Let's see. Giselle, I removed my Nexplanon back in November, got my period January, again Thursday. It can be a little irregular for a while. So, I would give it, what do you say, I had it removed in November? Another cycle or two, it probably will straighten itself out. Let's see. Shelby, have you ever taken care of someone who was on a Nexplanon and was pregnant? I'm pretty sure I've had someone get pregnant on a Nexplanon, so I think the answer to that's yes. No big deal, just take it out and you'll be fine. Leah, gallbladder issues after pregnancy. How common is it? Yes, it's extremely common, Leah. I really hope that it's not your gallbladder. It is super common. That's how common it is. And it is what causes it. We really don't know, but one theory would be the sort of the hormones of pregnancy make the gallbladder not function as well, make it kind of lazy. And as a result, you're more prone to having kind of backup of gallbladder bile and symptoms in that way. So we do think it's kind of a hormonal thing. Sorry if that's what it is. Let's see. Cat litter, is it bad? Is there anything dog related you should avoid? No, dogs are fine. See, dogs are better than cats. And actually, we have dogs and cats. So for anybody who's a cat person, cats are great, and our cat's actually our best animal. But just don't eat the cat poop, and you'll be fine. Nothing to worry about with dogs. Got a lot of questions coming in on YouTube. Hey, everybody. All right, let's see. Let me get caught up. Sorry, I got to scroll back. I've never had to have to scroll back. Okay, here we go. So music, feel the beat. That's a great name. I have PCOS. Can I naturally conceive without using Clomid or Femera? Yeah, I mean, absolutely it can happen. Plenty of patients who've gotten pregnant. The main concern is just, how regular or irregular are your periods? Because if you're infrequently ovulating, you have very irregular periods, it's kind of hard to nail down when you're actually ovulating, and that just makes it hard. And then secondly, if you're not ovulating frequently, that just means less opportunities to conceive. So yes, you can. There are things, And there's another question that somebody just below that, same thing, PCOS, how difficult will it be? It all boils down to your periods and how frequent they are or how infrequent they are. So it can be difficult. One of the main things you can do sort of naturally is lose weight. So not everybody who has PCOS is overweight, but a lot of people are. And there's a lot of data out there that shows that a modest amount of weight loss can actually reverse the effects of PCOS. We're talking 10 to 15% of someone's body weight if they're overweight. So it's not an impossible goal. It's doable. And so if you want to kind of stay away from meds, that's one way to go. All right. A little follow-up from Leah. Says she's got a scope and a HIDA scan. Don't know. What was that? I can't see the rest of that. If I don't have it out now, is it more likely to be bigger issues with next baby? If it's the gallbladder, yes. So if they're telling you it's your gallbladder, my advice, get it out before you get pregnant, because nothing's worse than it getting all flared up when you're pregnant. And then nobody will do anything about it. It's like, well, sorry, you're pregnant. So wait till you're not. So I'd get it taken care of if they're telling you that's what it is. So good luck, Leah. I hope it's not that. Amber, 36 weeks pregnant. I know you shouldn't self-diagnose. Yes, that's good advice. Feel like I have some SPD, so that's symphysis pubis dysfunction. Anything to relieve discomfort? It sort of fixes itself after pregnancy. Some people, physical therapy can help. There's not a whole heck of a lot else you can do because it's really bone on bone. There's not much you can do to fix that other than, have a baby. Especially as late to the game as 36 weeks, you'll have a baby soon, and that'll fix it. Let's see. Well, I should say I have not used Clomid or Femara before. Okay. Rihanna Ross. Let's see. 8 years trying on Clomid, 50 milligrams, second month. What's the usual time for Clomid to work? Most people who get pregnant on Clomid get pregnant in the first few cycles. Oops, sorry if I just nailed the microphone there. So typically, people who get pregnant on Clomid, it's within 3, 4, 5 cycles. I encourage folks very strongly to not be on it more than about 6 months. There is some evidence that it starts to kind of work against you in terms of what we call endometrial receptivity. So the hormonal changes that Clomid induce can potentially affect the endometrium, which of course is where the baby needs to implant. And if you're messing with endometrial receptivity, you're messing with implantation potentially. So if you're not pregnant, then my advice would be to move on to Femara. All right. Let's see. Love Vida, 37 weeks. Cardiologist said baby has an arrhythmia, premature atrial contractions, heartbeat skips. Doesn't warrant any special birth procedure. Yeah, we see that frequently, and I agree. Generally speaking, if the baby's heart rate remains in the normal range and they show no signs of heart failure, which they would totally see on a fetal echo, then you're fine. Don't worry about it. And the funny thing is that a lot of these, we find them and we hear it the whole time through labor. It's all skippy and weird. And then the baby's born and they're totally fine. It just goes away. So yeah, I wouldn't worry. It sounds like people are taking good care of you and keeping a close eye on things. So it doesn't sound like anything to worry about. Let's see. Is peppermint safe during the first trimester? Yeah. Conflicting info? Nah, it's fine. It's safe. If it helps your nausea, great. Go for it. All right. Let's see. What are your thoughts on stripping membranes? It's fine. There's a study that looked at people stripping membranes from 37 weeks, so once a week during their weekly visit from 37 weeks and beyond. And in the group that had membranes swept, we call it, less were still pregnant at 40 weeks in the group where they had the membranes swept versus those that did not. So I think from term and beyond 37 and up, it's fine. I tell people, it often doesn't help, but if it does, great. It's a small effect, if anything. But like I said, there was one study that showed, some potential. Hey, Dee Dee, how's it going? How common is postpartum thyroiditis? Very common. Do you have any videos on that? Not really. It's a weird one. It's kind of autoimmune, and we don't really treat it so much. We refer those people to endocrinology. I'm not going to claim to be an expert. It's basically like there's kind of two phases to it. You're either hyperthyroid, in which case sometimes you need to be treated for symptoms, palpitations or weight loss and sweats and just feeling awful. In which case, sometimes they use PTU or methimazole to try to slow down the thyroid hormonal production. and then eventually kind of burns itself out, and then you get hypothyroid, and then it's a matter of treating with thyroid replacement. Sorry, you're suffering from that now. That's a real drag. Are you hyper or hypo right now? They both have their challenges. Hypo, yeah. Well, at least you're through the worst part, I think, and now it's just a matter of finding the right dose of thyroid replacement. So best of luck there. Let's see. Kayla, sorry, I deleted my thing. That's okay. You put it back up. What's the evidence on estrogen and birth control while nursing? They were concerned. It's not a big deal. There are studies that show that if you have an established milk supply, so you're breastfeeding no problem, that the majority of people will not have a reduction in breast milk. I spend a not insignificant period of time every day, week, whatever, dealing with patient questions from a pharmacist who is concerned about something in pregnancy or postpartum. So you're not alone, but don't worry about it. It's fine. Now, I tell everybody the same thing. If you notice any reduction, then call. We'll switch you, but it's generally speaking not a big deal. So I wouldn't worry about it. Janner, hello. If you have a question, you can put it in the chat. Let's see, does putting your legs up after sex really help you get pregnant? It is not true. It's a good one. There's a video on my channel that talks about this, kind of like, I forget the exact name, but something along the lines of how to maximize your natural fertility. And it doesn't matter, so I do inseminations in the office. I'll tell people, you can get up, you can walk out here in 2 minutes. It's fine. There's no magic, sit in a certain position with your butt in a thing or whatever. It's fine. So you can, it's not a problem. The sperm are real fast. They're up in the tubes within minutes. So don't worry about it. Lemongrass, do you have patients practice hypnobirth? Yeah, no, I think it's great. It's not for everybody. It's not going to work for everybody. But for the people that it has worked, it worked great. So I had a patient to do hypno within the last month or so, and it was amazing. I honestly could not believe how well that lady did. Now, maybe that's just her. I don't know. But if you can do as good as she did, then it's great. Let's see. Francie says, is it normal to have period-like cramps during third trimester? Yeah, it's normal. So Braxton Hicks contractions. The thing I tell everybody is if they're mild, if they're irregular, then don't worry about it. If they are every 5 minutes for an hour and kind of hurt, you might be in labor, go to the hospital and get checked out. But if they're less frequent than that, if they go away when you rest, if they're mild, don't worry about it. Okay, let's see, Monique. Since you've had your baby, should you be worried if I even raise your voice or laugh, you get a striking headache that hurts really bad for a few seconds, then your nose bleeds, you haven't gone back to the doctor? That's weird. I don't exactly know what that is, but I wouldn't get it checked out. It's hard to know. The really scary one is someone says, I have a headache and my hand quit working and my arm's drooping, my face is drooping. That's a stroke. And, or a blood clot in your brain, do that kind of thing. So those are the ones that get checked out. But if it's still bugging you, I'd go get it checked out to play it safe. Let's see. Zula G says, my doctor prescribed progesterone suppositories. I tested 9 and she says you need to be 12. Is there any effects on the fetus? So there's really not good evidence that progesterone is beneficial for pregnancy support. I don't personally prescribe it to people because there's just no proof that it works. Now, on the flip side, it's not harmful. I don't think it's any big deal. But I kind of tend to be of the mindset that, if you can prove to me something works and it's safe, I'll do it. And if you can't prove to me that it works, then I'm probably not going to do it. So take it or don't. I don't have a big problem with it, but I wouldn't worry about it. Basically progesterone is a marker of fetal health. And so if you have a normal progesterone level, you have a normal pregnancy. And if it's a little bit low, you may still be fine. But this may reflect something going on with the pregnancy per se. And I mean, you can make your progesterone almost anything you want. You just give somebody enough progesterone, but that unfortunately doesn't improve the outcome of the pregnancy. So that's my kind of beef with it, is it doesn't really seem to help. Now it's different if you're an in vitro patient. Now I'm talking about spontaneous pregnancy here, but with in vitro, you do have to use progesterone. So I should clarify that. Let's see. Kimberly was on a copper IUD for almost 2 years, had to remove it for heavy bleeding, had the Mirena 6 months, having out September, getting tubes tied. About 2 months later, my periods have been crazy, bled for 2 months straight, could still Could still tell when I had your period because it's heavier. Da, da, da. Thought about coming in, but afraid they'd say it's nothing, which happens a lot to me when it comes to female issues. It may just be your IUD's out of place. So, you know, when people are having weird bleeding and pain, I always kind of think, well, maybe your IUD's moved. So I'd come get it checked out. It may not be anything, but it could be. So I'd get it checked out. Let's see. How can you tell exactly when you're ovulating? No, that's a good question. Just keep them coming. And Dee, I agree. The ovulation predictor kits and basal body temperatures are useful. Actually, the one that is the most predictive is cervical mucus. It's even more predictive than an OPK, ovulation predictor kit, by a little bit. So, and I'm not an expert on monitoring cervical mucus, not being someone who owns the cervix, but there's a definite change that occurs. And if you Google about it, I'm sure you can read up on it. Kind of what to look for, but the consistency changes right around ovulation. And it turns out it is the most predictive sign of ovulation. So check for that, maybe do some ovulation kits. Basal body temperature it sort of confirms ovulation. The thing about basal body temperature is it changes kind of after the fact. Except we don't have any, Didi says, and that's cervical mucus. So anyway, the basal body temperature changes kind of like after ovulation, and really what you're looking for are the days leading up to ovulation as the most fertile. So there you go. Kimberly said no IUD anymore. Yeah, well, if you're having weird periods, come get it checked out because you never know. Simple enough is typically I would do an exam, do an ultrasound, just kind of see what's going on. Let's see. Daisy, oh wait, sorry, Island Girl. Started clumping December last year. One cycle stopped. Plan to continue in March. Is that fine? Yep, that's no problem. You can kind of stop and start. No big deal. Daisy, ovulated with Clomid last month. 10.8 was your, I'm assuming, progesterone. 50 milligrams on day 37. No positive PK yet. Day 27. Yeah, it just sounds like you're probably not ovulating this month. Now, the only other thing you didn't mention, but sometimes I'll do a follicle check with ultrasound. There's a video on my channel about that. It's called How to Take Clomid or Femera. And I show some pictures kind of what it looks like if you're ovulating versus what if you're not. And so it's possible you're just not ovulating this cycle. You might need to increase your Clomid dose. It doesn't work every time. So typically if someone's having kind of hit or miss ovulation on Clomid, I have them come in for ultrasound. And I explained that in that YouTube video. So maybe check it out there on the channel. Let's see. Is it recommended to have intercourse after IUIs? Does not hurt at all. More is better. And I do talk about that some in that other video on the channel there about maximizing your fertility. But basically, daily intercourse is better than any other, like every other or one time or whatever. So more is better. It's not going to hurt a thing. Let's see. Karen had a miscarriage last year. Will be 38 this year. They want you to take thyroid meds, even though blood work came back fine, 3.1. Yeah, I mean, it's a normal thyroid, so there's not any proof that taking it is going to improve your situation. So I'm kind of with you. Some people, some fertility people like to see your TSH 2 or lower, and so that might be why they're telling you, which is fine. It's not going to hurt anything. But there's just not great data that really helps. So either way is okay. Let's see. Music, feel the beat. Ectopic last year. Metformin, made you ovulate. PCOS, when can you start trying to conceive? Yeah, I think you should be just trying now. It's fine. Just the main thing, of course, to know is if you've had an ectopic, you have a higher risk of having another one. And so when and if you get pregnant, the minute you think you're pregnant, your doctor should be following your HCG levels to be sure they're going up normally, because an abnormal rise is potentially an indication of another ectopic, and we know you have a little higher risk based on your previous history. So just keep that in mind. But no need to wait any period of time. Hey Bethany, how's it going? Priscilla says, is it common to have Nexplanon implant to halt periods that was supposed to start this month? It can. So with Nexplanon, your periods can be non-existent. They can be kind of random. They can be same. So it's not kind of any answer is normal. So yeah, if it stopped it, great. I mean, the chance of pregnancy is extremely low with any of these long-term methods like IUDs or Nexplanon, but it's never wrong to say, hey, we'll check a pregnancy test if you're worried about it. But most likely it's just the Nexplanon, in which case, bonus. That's great. Let's see. Just a CP. How high do you go on Clomid? So most people conceive on 50 to 100 milligrams. I have pushed it to 150 or 200. I've done that less frequently of late, only because the recent article I was reading basically showed that conception rates were not much better by going up any higher than that, unless you just don't ovulate. But most folks will ovulate on 50 or 100. 200 is getting up there. You just kind of tend to run into side effects, hot flashes, and moodiness, things like that. And you might have a little higher risk of twins by going on those higher doses. So I would never go straight to that. I would kind of, ease my way up if I was going to that high. But typically, if you're not ovulating at 50 or 100, particularly if we're doing follicle checks and there's no signs of ovulation, I'll just switch over to Femara. So that's letrozole if you don't know that Femara's generic name. Okay, man, that was a ton of questions. Thanks, everybody. If I missed your question, let me know. I don't think I did, but if I did, let me know, because I think I've answered everything. I think that's it. So while I'm, here's one. How soon can my wife get pregnant? I'm assuming after IUD removal, 35. Yeah, go for it. There's plenty of evidence that fertility is immediately restored. There's no need to wait. So best of luck. Hey, there's a video, by the way, on my channel there called Is 35 Too Old to Get Pregnant? Obviously the answer is no. But it talks about some of the testing options that you have for folks who are 35 and up that are specific, let's say, to people who have a little bit of a higher risk of chromosomal abnormalities. Although, honestly, anybody can do them. They're just more expensive. If you're low risk, a lot of times insurance won't cover it. Okay, let's see. Rachel, going to see a fertility specialist soon. Should we give up if he can't help as you're 47? Well, no, I don't think you say give up. I think the thing they're going to tell you, though, almost guaranteed, is your chances of, it says you're 47. That's the right number? If you really want a baby, do in vitro with the donor egg or donor embryo. So, your uterus does not age, and if you're otherwise healthy person, it's okay to get pregnant, but the chance of pregnancy spontaneously or with IVF at 47, it's not zero, but it's pretty close. So, I think ethically would say to you, you probably shouldn't take your money and then try to stimulate your eggs at 47, but it's no problem to use donor eggs or donor embryos. So I think that they would probably steer you that way if it says you're 47. So just tell me, yep, that's right. That's what I meant. That'd be my advice. So I wouldn't give up. I just think you might need some other techniques. Okay, Sonia on letrozole. That's not an option. So Clement. Yeah, I mean, you can try it. It's kind of the same answer. At 47, the chance of pregnancy is pretty low. It can happen, and you can certainly try. And I would never tell someone no. I would just say the likelihood's real small. There's not too many spontaneous pregnancies at 47, unfortunately. Sorry. Okay, let's see. Sonia, on letrozole, undergoing monitoring, cervical mucus shows up before doc says you're ovulating. Should we have intercourse when you see cervical mucus? Yeah, absolutely. So you should be having intercourse in the several days leading up to ovulation. Really, the 5 days prior to ovulation are the most productive. So I recommend to folks, if you kind of know about when you're going to ovulate, those 5 days leading up to ovulation really are the best days. So yeah, absolutely, you should be having intercourse daily during that time frame. Rihanna, after being on Clomid, first child is your second and so on, likely happen without meds again, or should you have to go through, everybody is different is kind of the bottom line. But a lot of folks who needed Clomid to get pregnant might need it again, but there's no guarantee that you would. Rachel, sorry about the miscarriage. Yeah, I mean, that's the most common if pregnancy occurs is that it'll lead to a miscarriage, and that's because chromosomal abnormalities are so much more common, and they are of a type that are often associated with miscarriage. Let's see, Karen, what at 38, what's the chance of getting pregnant naturally? Off the top of my head, I can't quote you a number. It's lower, but it's not zero. That's a fact. I'm trying to think what video. I have if you look at the video called "Should I Freeze My Eggs?" there's a little blurb in there that shows it's IVF data, but it kind of gives you the idea of, and it showed the breakdown. You can kind of freeze the frame, and you'll see a little table, and it shows by age what the pregnancy rates were, and that would tell you. Otherwise, you can probably just Google it, and you'll find plenty of data that shows, like, at this age, what's the chance of spontaneous pregnancy. It's still a possibility. Okay. Take a breath. If you're jumping on, welcome. Put a question in the chat if you have one. Welcome over there on YouTube too. Looks like everything's still working. If I missed your question, just repost it because I think I'm caught up. I'm just going to take a sip here. Hello from the UK. All right. Welcome. Somebody on earlier was from Australia. This thing is crazy how far away people jump on YouTube from. Let's see. Sheena. Pregnant, baby number 3. Last 2, got induced 37 weeks for blood pressure, preeclampsia. Likelihood it'll happen again. And it cuts off and says, and I've been So I'm not sure. If there's more to that, you can let me know. But there is a chance of recurrent preeclampsia. Having restless leg syndrome a lot. How is the iron? Is low iron associated with this? Yeah, but you're taking iron, sounds like, so it's probably not that. Some people it helps, some people it doesn't. The big thing, and you didn't say how many weeks you are, Sheena, but if you're over, say, 13 weeks or so, hopefully you're taking a low dose aspirin. So there's evidence that taking a low dose aspirin from around that 13, 14 weeks through the end of the pregnancy reduces the risk of preeclampsia happening again. So you need about 110, 120 milligrams of aspirin. In the US, the easiest way to get that dose is just take a normal dose aspirin, break it in half, and that's close enough. The low dose aspirin in the US is 81 milligrams, and they're tiny. So you'd need like 1.5 of those, and it's pretty hard to break those things in half. So I just do half of a normal size aspirin. Let's see. Zuli says, how accurate is the blood test for genetic testing at 35? Yeah, so if you're talking about cell-free DNA, if that's the one you're talking about, it is, oops, sorry, banging the microphone again. It's extremely reliable for the conditions that it tests, and that's important to understand. It really only tests for 4 things. Down syndrome, which is trisomy 21. It tests for trisomy 18, trisomy 13, and sex chromosome abnormalities. So, for example, Turner syndrome, which is 45X. You're missing 1X chromosome. That's the only 4 things that test will test for. It's the 4 most common, but it's not everything, and that's important to understand. For those 4 things, it's very reliable. It's never going to be 100%, but it's up there 99 point something something. So, most people feel very comfortable kind of hanging their hat on that test for those conditions. I mean, the main thing to understand is it doesn't test for other stuff. So if there are lingering concerns, say based on ultrasound or something like that, then oftentimes people go to amniocentesis or chorionic villus sampling to be able to sample all the chromosomes, because this DNA test only does the ones I mentioned. Let's see, Rachel, cycles are kind of short. Ovulate day 12 sometimes. Yeah, I mean, so if you're kind of going those 5 days prior to ovulation, you've got your bases covered, which sounds like you do. So I think you're doing it right. Let's see. And hello from Houston, Texas to you, Jay Mustang 03. Let's see. Karen, if you can't really pinpoint when you ovulate, how often should you have intercourse? Oh yeah, we were just talking about that a minute ago. Precede's fine. The 5 days leading up to ovulation are the best. So kind of once a day during that time frame covers your bases. So if you don't have the exact answer, it's okay. You just kind of get those days leading up to when ovulation should be, and you should be good. Let's see. For PCOS, how long is it recommended to be on Provera? When should you take a break? So I'm not sure I understand your question. So if you're trying to get pregnant, you shouldn't be taking Provera, like in and of itself, because it's kind of like birth control. Some people prescribe it for the second phase, the luteal phase of the menstrual cycle, so after ovulation, which I've mentioned before. It's fine, but there's really just not good evidence that it does anything for you from a fertility standpoint. Now, if you're not trying to get pregnant and you're using it just for like cycle regulation, that's totally fine. And most folks take it for a couple weeks per month just to induce a period. So maybe that's what you're talking about. Sheena, 27 weeks on 81. Yeah, just take a half of a regular dose of aspirin and you're fine. There's just the reason I say that is there's a big study that was kind of like looking at the different doses to see what was the most effective. And it turned out that about 110, 120 is the right dose, and 81 is a little bit low. So you could do 1.5 of those 81s if you feel like cutting them in half, or just do half of a regular 325, or talk to your doctor about it. Okay, is Cuvade syndrome real? Well, I don't know because I've never heard of it. Let me Google it. Cuvade syndrome. Well, here's Wikipedia, always reliable. Sympathetic pregnancy, proposed condition, and partner experience. Weight gain. Well, this is what Wikipedia says. The Excellent Medical Authority is not recognized as a real syndrome. Source is a matter of debate. It's believed to be a psychosomatic condition. Probably true. Probably true. Okay. Let's see. Bailey. Had an IUD placed back in June, missed your period January, cramping every day. Is it something to get checked? Not wrong to get it checked. I always tell people if you're having like weird pain or bleeding and you have an IUD, just get it checked out. It's simple enough to do an ultrasound. If everything's fine, then great. Maybe it's still the ultrasound, but it's not causing a problem. But if you don't check, you just don't know. And so if it's been January, so you're talking like a couple months now, it's probably not a bad idea to get that checked out. Rachel, thyroid 5.2, doctor says fine, could have caused miscarriage. No, there's really no proven association between your TSH level and your miscarriage risk. So I don't think that's got anything to do with it. If your thyroid is out of whack enough, then you might not ovulate. Like if you're severely hypothyroid, if your TSH was like 15 or 20 or 30, some of those folks aren't having periods, but it won't cause a miscarriage. So don't worry about that. Let's see. Lemongrass, as a first-time mom, is there anything you can do to minimize your chance of getting a C-section? Yeah, there is. And there's actually a whole video on my YouTube channel about this called How to Avoid a C-section, I think it's called. But a couple things. One is don't gain too much weight. If you hear banging in the background, that's my dog chewing on something. One is don't gain too much weight. And the Institute of Medicine has BMI-based weight gain recommendations, which I put in that video, so you can check that video and freeze it on the frame, and it'll show you by your BMI what you should gain. So if you gain too much beyond that, then your risk of C-section goes up. And then another whole concept of how to reduce your chance of having a C-section, there's kind of two things. One is make sure that when you're in labor, adequate time has been allowed for labor to progress. And there's a whole article on this in what we call the Green Journal. It's called Obstetrics and Gynecology, that basically says that everything we thought about how long it should take somebody to have a baby was wrong, and that we were doing it wrong for probably 30 years. So we all had to relearn some things along the way about that. And the big one is just give it more time. So, if you're in active labor, which is now defined according to that article I'm quoting you right now as being 6 centimeters or more, that if you are not changing your cervix, that you need to give that person 4 to 6 hours per centimeter. So if you're 6 and you're 6 an hour later, you need to give them 4 to 6 hours total before you start thinking it's not going to fit. So that's a big one, is to have a provider who is willing to do that, when allowed. So in other words, like if the baby's not tolerating labor, then that's not a thing. Can't do it. But assuming everything's going okay, then that's a really important aspect is, the management style of your labor by your provider. Now, a year ago, some people might have said, and don't be induced. Don't be induced because it's going to increase your risk of C-section. And it turns out that's wrong. So there's a video on my YouTube channel about that too. It's called Should I Be Induced? And it's based on this trial that had 6,000 some odd women in it called the ARRIVE trial. And we participated in that trial at McCady Hospital here in Ogden. My dog wants to go outside. He's ringing the bell. If you hear the bell ringing, that's what that is. But anyway, the bottom line was that in the group that was induced 39 to 40 weeks versus the group that were managed expectantly out to 41, the induction group had a lower C-section rate. So based on that, you say, well, then that whole thing about don't being induced is not right. But it probably does go back to but you got to give plenty of time. You have to be patient if you're going to be induced. And what I tell people is, if I'm inducing you and it's your first baby, just be ready for 24, 36, 40 hours of labor. Not all of which is going to be hard labor, but it's going to be labor, and you're going to be there that whole time, so you got to be committed. And in my experience, it's very infrequent to have a C-section for failure to progress or whatever in that scenario. Now, there's still going to be C-sections where the baby didn't tolerate labor, and there's still going to be C-sections where the baby didn't fit, but it's gonna be after the appropriate amount of time was given, as far as I'm concerned. So those are the big ones. Don't gain too much weight. And have a patient provider and be a patient, I guess. Let's see. Haley, if I have cramps come, go at 10 weeks, no bleeding, there's nothing to be worried about. No. So bleeding is super common, cramping, super common in pregnancy. My experience is it seems to be more common the more kids you've had. So I kind of hear like, well, I didn't have this the first time. And then the third time they say, well, I had this the second time, but not as bad. So I think it gets worse and it starts sooner, it seems like, every pregnancy to me. Cramping in and of itself, if there's no bleeding, I don't think it's anything to worry about. If you're having cramping and bleeding, then I'd get that checked out. Let's see, Rachel, normal period, 3 days later, a little spotting. Well, it wasn't mid-cycle because that'd be too soon, I think. Why does it happen? It's probably just kind of hormonally... I mean, I'm guessing, at 47, egg quality is probably not the best. And hormonally, they're not cranking out the hormones like they did 20 years ago. And that might have something to do with sort of the shorter cycles you were talking about earlier, as well as some of this kind of irregular bleeding. So it may come down to egg quality and how that relates to hormonal secretion. Let's see. Genesis. Going to my IVF consult next week. I'm worried I'm plus size. How big is too big? I like the too bug. It's a good question. And, honestly, I'm not a reproductive endocrinologist, so I don't do IVF, and so I'm not going to claim to be an expert in that topic. But I can just kind of tell you in general that, there's plenty of people who are overweight who've conceived with IVF and had babies and done fine. But on the flip side, being a healthy weight for your height has tremendous benefits for getting pregnant, staying pregnant, having a natural delivery, and all those things. So, to the extent that you improve on that situation, you're only helping yourself. So, I don't know what they're going to tell you as far as, at your IVF center, do they have a BMI cutoff or anything like that? I don't know. I guess you'll have to wait and see. But, honestly, the more you can do to just work towards a healthier weight, like I said, you're only helping yourself. Giselle's kind of same question as being overweight make it harder to conceive. It can. It can because PCOS is more common if you're overweight. And if you develop PCOS, you tend to ovulate less frequently. And if you're not ovulating as frequently, well, then you just have less number of opportunities to get pregnant. And then what can I take for birth control for my PCOS, if you're not trying to conceive? Is it bad to not have a period at all? In the spontaneous situation, in other words, you're not on medications, you don't have an IUD, this is just your body, what it's doing, is it okay? That's a little higher risk in the long term for endometrial hyperplasia and cancer. So hyperplasia is a precancerous condition, and cancer is cancer. So we do recommend I do, I was a we, like I have another person that's sitting behind me that agrees with me, but I recommend if you have PCOS, if your periods are infrequent, and if you're overweight, that having a period every month or two is a good thing. So if I have patients like, I don't have a period for like 6 months, you probably ought to have a period every couple of months, even if you just take a little progesterone for a week, once a day, and then stop the progesterone, it'll trigger a period. And that will, the idea is that'll get your endometrium to shed and get it out of there so that it's not just building up, because the concern is you could develop hyperplasia, and that is a precancerous condition. So I think if you're not trying to get pregnant, even just take a little progesterone once a day for a week or so every month or two to have a period. That's what I would typically recommend. Let's see, Misha thanks. A little nausea on and off, skin is flushed with anesthesia cause that. Probably not from Tuesday to now. It could be some pain medications, could be a hormonal thing. So, you know, my standard post-operative precautions go like this. If you have a fever of 101 or higher, severe pain, redness or drainage from the incisions, if you had incisions, then, you know, any of those things would be warning signs. I'm not discussing what I did for your surgery. You've said I did your surgery, so I'm not violating HIPAA currently. But those are kind of the general recommendations I'd tell anybody. But it doesn't sound like anything of any major concern so far. Let's see. What are some of the early signs of PCOS? I don't know that there's like early versus late. Well, I guess there are some later signs, but I mean, the most common stuff is just infrequent periods and signs of androgen excess. So what does that mean? Like facial hair, acne, abdominal hair, those are the most common. It probably takes a little time for that to develop, and so maybe those are some of the later signs. But, you know, I mean, it's kind of hard to know like early versus late. So those are the signs. How's that? Another one that's definitely a late sign is it's called acanthosis nigricans. It's sort of this velvety, hyperpigmented skin. You typically see it like in skin folds and creases, so like armpits, in the thighs, you know, places like that. So those are kind of the later signs. Some very swollen breasts before period. Any tips? Yeah, I mean, there's some evidence that vitamin E supplementation helps. There's some evidence that that reducing caffeine reduces breast pain. There's a good, interesting study from France that looked at people who were professionally fitted for their bra versus someone who just kind of did their own thing, and it turned out that if they were professionally fitted, they had less breast pain. So maybe just like having the bra that's properly sized. So there's some simple things. Let's see, Tori, 16 weeks, gained 9 pounds, started off 123, 133. Is that normal? No, that's reasonable. You know, you want to gain maybe 25, 30 pounds total pregnancy. And if you're roughly, you know, a third of the way there, then you're doing okay so far. Let's see. I've taken Clomid for 2 months. Ovulation tests were negative. No monitoring, ultrasound, blood work. Hormones are normal. Pelvic usage are normal as well. So there's not really a question there. So maybe if you have a question, you can, because you gave me, that's Zoza Sue. Tell me what your question is, because you just kind of told me what's going on, but not a real question so far. Let's see, Rachel, ovulation test every month, always get a positive, ovulating but not catching. Yeah, I mean, it sounds like you're ovulating. The cervical mucus thing I was talking about earlier is another way to kind of verify ovulation. So if you're seeing definite changes there, then that's encouraging as well. But it certainly sounds like it. You mentioned earlier, periods are a little bit shorter cycle, but fairly regular. So yeah, it does sound like you're ovulating. So I think you got your bases covered there. Let's see, how early can twins be detected? Let's say certainly. Usually, usually 7 or 8 weeks, and sometimes even earlier, because there's this early ultrasound sign called a yolk sac, which is the first sign of an embryo. And generally speaking, you got 1 yolk sac per baby. So if you see 2 yolk sacs, there's another baby in there somewhere. And sometimes you'll even see 2 gestational sacs that early. But it can be tricky. So, I mean, I've had situations where, someone had some bleeding and you do an ultrasound and you see 1 baby and then you see this other area that's kind of like, I don't know, is that bleeding or what? And see them back a couple weeks later and there's a baby. So that's happened every now and then. But in general, definitely 7 or 8 weeks, no problem. Occasionally earlier. Let's see, is it normal to have severe low back pain, cramps, period, not stomach, during period? Yeah, I mean, definitely some people feel them in their back, so that's not uncommon. Let's see, so Zoe says, just want to know what to do next since periods are irregular, ovulation tests are negative. Yeah, so I would monitor with ultrasound. So I would have my patient take Clomid, and it's all described. There's a video on my YouTube channel that you're watching right now. There's a video on that channel called How to Take Clomid or Femera, and I walk through every step of what I do, like day to day. I would do a follicle check around day 10 of your cycle, 10 to 12, and see if it's responding. And if it's not, then you probably need a higher dose of Clomid, and if that doesn't work, then you probably need a medicine other than Clomid, like letrozole, for example. So that's kind of where I would go with that, is you probably ought to be getting follicle checks. That might help. Okay. Let's see. Karen, that's interesting. That popped up there, but not there. There it goes. Since my miscarriage, I've lost 60 pounds, normal cycle, still wants to do infertility because of your age, which I think was 38 if I remember from earlier in the chat. Not wrong, not bad advice. Sounds like you're doing good things, but not, I frequently would tell somebody 38, 39 years old, don't waste a whole lot of time not seeing a specialist, because time is not on your side, and you just kind of want to have as many options available as you can. And you hate to get to the fertility specialist at like 39 and then they go, oh, well, if you'd only been here when you were 38, we could have done this or that. So I tend to agree with that recommendation is, be more aggressive when you're in your late 30s, because you just don't know how much time you have. But we do know the time's not on your side. So I agree with their recommendation to get more aggressive and see a specialist. That's probably good advice. Let's see, best birth control method for someone with a history of depression or anxiety. Really, any of them could be fine. And it's such a personalized thing that it often becomes this sort of quest, to find the thing that works best for you. So it's not like you can say, oh, well, definitely this is the right thing and don't do that. So hard to give you just sort of a blanket answer. The one that I do tend to steer folks away from, though, is Depo-Provera. I've just seen enough like depressed people get more depressed on Depo-Provera that I tend to not use it in that situation. So that's the only one I say kind of avoid that. Pretty much anything else is fair game. And then you just kind of got to see what works best for you as an individual. There is a video on my YouTube channel called What Can I Do for Birth Control, I think. So you might look at that one. Kind of talk through all the options, all the pros and cons, and kind of really work through it. And you're thinking about the implant method. Yeah, next one on, it's good birth control. It's good for 3 years. Irregular bleeding is the most common side effect. I don't tend to hear a whole lot of complaints about mood on that one. So that's probably a good choice. Charlene, would you recommend baclofen in pregnancy? It's kind of an oldie but a goodie. I can Google it just to see what, not Google, but I have this reference that's like drugs in pregnancy for, that I pay like a subscription fee to. So let me just see baclofen. It's been a minute since I prescribed that. It's probably fine is my gut instinct. Baclofen. Let's see what it says. Fetal considerations. Like most of these, they'll say the same thing. There are no adequate reports in human fetuses. It's unknown whether it crosses the placenta. There is a single case report of neonatal convulsions or seizures at 7 days of age. That doesn't mean anything. Rodent studies reveal increased prevalence of valsalea, which is an abdominal wall defect, incomplete ossification of the sternum, vertebral arch widening, and neural tube defects given at 10 times the recommended dose. So one thing's for sure, don't take 10 times the recommended dose. When I see stuff like that, it's kind of like what I said. There's not great data. It's probably okay. If you don't need it, don't take it just to play it safe. But if it's like the one thing that's going to keep you alive through the pregnancy, then I think you do what you got to do. It looks like it's probably not a huge risk, and definitely don't take it at 10 times the normal dose, and you should be fine. I love how they do that. We gave it to rats at like 10 times the normal dose, and it did not end well. Let's see. Faith said hello. Hello, Faith. Londi. I got treated for preterm labor because you're having contractions in your back. They were brutal, by the way. Or maybe the treatment was brutal at 26 weeks. And now practically on bed rest, going stir crazy, not being able to do anything. Yeah, that's one of the downsides. Back hurts. Can you sleep on your back if you use a large wedge pillow? It's not so that you're propped up. The idea of sleep positions in pregnancy is that you don't want to be flat on your back. It doesn't matter, like okay, flat. Can everybody see this flat? I can't tell. Like this. This is still flat on your back because your uterus is still compressing your vena cava. So what you need to be is rotated. So whoop, like this. So if you put a pillow under one hip and rotate, then you're not flat on your back, and your uterus will kind of fall off to the side, and it won't compress your vena cava. That is my hand right now. So some people say, oh, well, I sleep in a recliner, but yeah, but you're still flat on your back, so you're not rotated. That's my funky pinky. That looks kind of weird. Broke that mountain bike in here about 10 years ago. Any ideas to help Pepper not hurt so bad? Not really. Sorry. But it's for a good cause. I'd keep doing it. Is green tea okay to drink at 16 weeks if you've had 5 losses? So there's some, I don't know, you didn't say, but if it's caffeinated, there's some interesting research on caffeine intake in pregnancy, which, not to sound like a broken record, but I made a video about, and it's on my YouTube channel. But the gist of it was that there is some association with higher intakes of caffeine with childhood obesity. So at 200 milligrams a day of caffeine, there was a detectable higher risk of childhood obesity at like 8 years of life. So like a long-term effect. Lower doses, not so long. So like at 50 milligrams, I think they were detecting it at 3 years. So it's not 100% without risk. I tell folks maybe try to keep it under 50 milligrams a day, or try not to have it every day, and you're probably doing your soon-to-be child a favor. Let's see. AKK. I like that, AKK. How successful is IUI? Depends on the situation. Depends on why you're doing an IUI. So it's kind of hard to give a number just blunt, like, what is the number? So the short answer is it depends. So I guess the follow-up question is, what's the indication for the inseminations? Is it for male factor infertility because sperm count's low, or just for empiric treatment of infertility because everything's normal, but we're just trying to help you get pregnant? So give me a little follow-up on that, and I'll try to answer it a little better. Let's see. Riley just got vitamin D tested. Yours is low. They recommend 4,000. That's fine. There's a video on my YouTube channel. Surprise, surprise, about this. And it showed higher rates of conception, lower rates of miscarriage in moms who had normal vitamin D levels. So I have been kind of telling people who miscarry, maybe take a little extra vitamin D. I don't think it's wrong to check levels, but if you just take, 1,000 or 2,000 international units a day, you'll get to normal levels. So yeah, the issue is higher rate of miscarriage, lower rate of clinical pregnancy in folks who are vitamin D deficient. So if you're out there trying, that's one thing to throw in there. Rachel is interested in that too. We've been talking about that all back and forth here. So taking vitamin D is good advice. And I talk about it on my YouTube channel in more detail. Let's see. Keep an eye on thyroid symptoms, but what prenatal vitamins are safe? Any prenatal vitamins, fine. So there's not anything, like as long as you've got at least 400 micrograms, 0.4 milligrams of folic acid, then you're going to get enough folic acid to help protect the baby from spina bifida. So as long as you're getting that, you're good. Let's see. Semen analysis is normal. So is HSG. Only issues hypothyroid. Would IUI help in this case? So sometimes, yeah. So that's kind of what I was getting at. So this is what you would call empiric treatment of infertility. Like everything's fine, we're just not getting pregnant. So now what? And so oftentimes we'll do Clomid or Femera along with inseminations to try to help. It's sometimes helps. Generally speaking, 10 to 15% pregnancy rate per cycle is what you can count on in that type of scenario. So it's still not super great, but it's better than nothing. And especially if you've had trouble getting pregnant on your own, then that is very commonly what we would do. And we would often do that for, some number of cycles, and what that number is very depends on the person, but 3 to 6 cycles is certainly reasonable with Clomid. And then with Femera, maybe 3 and 3 is kind of what I would often do. 3 cycles Clomid, 3 cycles of Femera. And then if they're not getting anywhere, then you kind of move on to sort of this super ovulation treatment. So injectable fertility drugs to try to make more than one egg come out at a time, just to up your chances of getting pregnant. And if that's not getting it, then sometimes in vitro is what you have to do. Let's see. Amy asked another video, but since you're live, figured to ask you here. What do you think when still experiencing pain and the scarring of your tear? It's been 4 months. Fairly common. I mean, most folks by 4 months are probably okay. So I think that's a little longer than average. It may still be everything's fine, particularly if you're nursing. So if you're nursing, you don't make as much estrogen, and so vaginal tissue can be a little thin and irritated and painful. So it could be something as simple as that. So my advice would be, if it's still bugging, to get checked out, because maybe it's a simple thing that is easy to resolve. So I get checked out. All right. Let's see. If you have light periods, does it affect your fertility levels? No, as long as they're regular. So, if someone says, I have a light period once every 6 months, that definitely is not compatible with fertility. But if you have a light period every month and it's regular, and when your period's coming because you have some premenstrual symptoms, whether that's breast pain or bloating or moodiness or whatever, and then your period starts shortly after that, then you're ovulating, and that's every 5 weeks, pretty close, 35-day cycle, not bad. But that if all else is normal, then and someone wasn't getting pregnant, I'd say, well, Mel, let's try some Clomid, see if we can kind of get you more in like a 28-day cycle, because it just means you have less chances per year to get pregnant if if you're 35 days instead of 28. Well, that adds up over the year to probably a couple less chances per year of conception. Let's see. How do gynos help regulate someone's periods? 35 to 70 days. So yeah, a lot of different ways you can manage that. Simple ones, just birth control pill. That'll often get you back to sort of a regular cycle. If someone's not trying to get pregnant, that's probably the easy answer. If you're trying to get pregnant, then we got to get that person to ovulate more regularly so they'll have more regular periods. So I kind of always think about it like that. Like, you're either trying to get pregnant or you're trying to not get pregnant. And then I help the person from that perspective. So if you're trying to get pregnant, let's help them ovulate regularly and have regular periods till they get pregnant. If they're not trying to get pregnant, then considering some sort of hormonal treatment to get their cycles to regulate is fine. Also worth mentioning that any hormonal method that you did continuously, like an IUD or a Nexplanon or even continuous birth control pills, it's okay not to have a period in that situation, which is different than what I was talking about earlier with somebody with PCOS who said they have infrequent periods. That person has a higher risk of endometrial hyperplasia and cancer. And so if you're out there spontaneously every 35 to 70 days, you might have a little higher risk in your lifetime of endometrial cancer. But if we suppress your periods medically with progesterone, whether that's, like I said, IUD or Nexplanon or whatever, then that's fine. And actually that reduces your risk of cancer. So kind of big picture, that's how I think about it. Let's see. AKK. Do you have any thoughts on supplements? Maca, it's no proof. Ubiquinol sounds like ubiquitous. That sounds like, yeah. Do these really help? No. They're probably all a tremendous waste of money. There's really no evidence of any supplement, honestly, pretty much of any kind, with the exception of specific vitamin deficiencies in an individual patient. So if you're low vitamin D, replacing your vitamin D. If you've had weight loss surgery and you're low on B vitamins because you can't absorb them, then in those situations, supplementing those specific vitamin deficiencies definitely is important. But if you're talking about an otherwise healthy person who's using supplements, pretty much none of them are of any use. And it's kind of a shame that, at least in the US, supplements are not regulated by the FDA. People can just say whatever they want. They can charge you however much money they want to. And it's just really no proof that they help. So I don't recommend any of those things. Ubiquinol, that's a great name. It sounds like, ubiquitous, which it just sounds like the ultimate marketed, like somebody really thought hard to come up with that name. But yeah, I wouldn't recommend any of that stuff. Let's see. Rachel, periods are heavy, feel really unwell first few days. Is this a healthy thing to do? So use up to 8 pads a day. Well, I mean, it's kind of the opposite of what we were talking about earlier, which is trying to get pregnant. If you're trying to get pregnant, you're kind of stuck with your periods because you got to have them in the whole process of trying to get pregnant. But if someone's not trying to get pregnant, then any kind of hormonal treatment could help. So treating the symptoms at least during the period, maybe like ibuprofen, 800 milligrams every 8 hours, something like that, will help with cramps, and sort of generalized blasé feeling might help with that too. It may slow the flow down a little bit. And there is a medication called tranexamic acid, or Lysteta, that is approved for heavy menstrual periods, and you only take it during your period, so that's okay. That wouldn't interfere with getting pregnant. So that one's okay too. So those are options that could help slow down some of the bleeding. Let's see, Carla. Have you ever had a patient ask you to help her get pregnant but then change her mind? How would you help her deal with that? Been seeing my doctor for a few cycles. Clomid didn't help. Now you just want to focus on regulating cycles instead of getting pregnant. That's fine. Unsure because I feel like I'm just scared to continue trying. Nothing happening. I mean, it sounds reasonable. Well, yeah, I think that happens all the time. People decide to take a break, focus just on trying to feel better and moving on with their life for a little while. I don't think there's any problem with that. Is diclegia safe for the fetus? Yes. Is it, you've read it could harm babies hard? Is that true? No. There's something like 50, 60 years of safety data on the ingredients of diclegia, which is doxylamine and vitamin B6. That's my dog. So I don't worry about that at all. Diclegia is fine. It's considered the first treatment you should use if you're nauseous. Hey, I'm doing a live stream over here. See, can you see him? Is he over there? There's the lazy dog. There he is. There's Chance. He thinks it's time to go for a walk, probably. Let's see. Oh, well, now I realize, like, if you're watching me on YouTube, you can't see the dog. Well, sorry. That's all. The camera's on a tripod. It's hard to move. Let's see. What age do you perform sterilization on women without children? It's a good question. And there's no hard, I mean, you got to, hush. You have to be an adult, obviously. I may have to go put my dog up. If you're wondering what this dog looks like, if you're on YouTube. There he is. There's Chance, the corgi. Yeah. Great, thanks. Everybody knows you're here now. We get it. Okay. See if we ignore him. He might stop. Okay. We're going to answer a couple more questions. And then I'm going to have to take my dogs for a walk. Anyway, got to be at least an adult. Got to be... Good grief. Okay, hang on. You're gonna have to go outside or something because you can't talk. Okay, now it's barking outside. Let's see. Just because everywhere says something different, when's the real end of the first trimester? 12, 13 weeks. Let's see. Justin, Calmate, solving. I don't know what that means. Okay. Cool. I don't think I missed anybody's questions. So, having said that, I've been streaming for an hour and 10 minutes. Holy cow, didn't realize that. That went really fast. So we'll maybe say give it another couple minutes here. If you have a question that you were dying to ask, put it up in the chat and I'll answer it. And otherwise, I'll probably wrap this up here in the next couple minutes. Here's a question. How would you know if your fallopian tubes are clogged? So there's a test called a hysterosalpingogram, and it's an x-ray. And hang on, I gotta fix this. I think that this is crooked. There we go. It's an x-ray test, and you shoot contrast dye up in the cervix, and on the x-ray you can see, you can see if the tubes are blocked or not. So that's the easy answer. The easy answer, HSG. Let's see, can you express colostrum before birth if planning to form the feed? You could try. I don't know how much you'll get, but I suppose you could try. It's not of any harm. So I think that's fine. Okay. I think I'm caught up. We'll give it another minute, see if any other questions pop up. Otherwise, we'll call it a day. It's been a good stream. We're at an hour and 12 minutes almost. Holy cow. It's pretty crazy. So if anybody's got a question, go ahead and stick it in the chat. We'll give you another couple minutes here and then probably call it good. Let's see. Can you take prenatal vitamins continuously for longer than 6 months? Yeah, take them forever. You can take prenatal vitamins every day for the rest of your life, and it's totally fine. Hey, thanks. Good night to you as well, Island Grilled, because it's probably like almost 11 o'clock there in Italy. Have a good night. Let's see. Does placenta encapsulation reduce the risk of postpartum depression? No. There's absolutely no data on that whatsoever. It's a total internet-driven, trying to think of a nice way to say it, just completely placebo effect. It's just not, there's just no proof whatsoever. It is very popular. It's a moneymaker for people who charge other people to do it. But there's just no proof whatsoever of any benefit at all. There is at least one study that showed a higher risk of infectious complications. There's a case report, and I realize this is a case report, but it's a case report of a baby who got group B strep sepsis with meningitis and really sick in the ICU, and it was from the placenta. So I don't recommend it. There's no proof that it helps anything. There's really just no proof whatsoever of any help, and there's some concern for potential harm. So I don't recommend it. If somebody wants to do it, that's fine. It's a free country, but I don't recommend it. Let's see. Wife had next way 3 weeks pregnant. Didn't know she's pregnant. It'll be fine. Will harm the baby? No, it'll be fine. So there's just no concern about a single X-ray. Barely pregnant won't cause any harm at all. So especially it was on her tooth, so it wasn't even aiming at her uterus. So she'll be fine. Thoughts on lansoprazole in pregnancy? It's fine. Yeah, all the heartburn meds in pregnancy, there's no evidence of any risk, so don't worry about that. Okay. We'll see if anybody else pops up next minute or so. Otherwise, we'll call it a day. Good night from the UK. Just take care. Sleep tight. It's 10:52 p.m. in the UK. Greenwich Mean Time. Sleep tight. Okay. Not seeing any other questions popping up, so I think we'll wrap it up. I was going to talk about 11 p.m. there. Yeah. 22:53 is what my watch says there. Yeah, cool. I was going to talk about cord blood banking today and didn't get around to it. So stay tuned. I'll make a video about it. Basically, don't do it. It's a waste of money unless you have a kid already that needs stem cells. Like doing it for your future kid is basically like about a 1 in 20,000 chance you'll ever use it. And it's expensive, so I wouldn't recommend it. But if you can give it to a public bank, that makes perfect sense. And I would encourage anyone that has a public cord blood bank in their area to donate their cord blood, because there's plenty of uses for that. Plenty of situations where it could help. But the chance you're going to use your own stored unit of blood for your own child is almost zero. And it's expensive. So, does Candida prevent fertility? No. Is keto safe during pregnancy? No. Good question. There's an association with keto diet and spina bifida, actually. So that's a spinal cord defect. So you definitely don't want to be doing keto when you're pregnant or trying to get pregnant. How big of a baby determines if you need a C-section? Short answer is if you're not diabetic, if your baby's over 10 and a half pounds, you got to at least have that conversation. And if you're diabetic, then 10 pounds and up is kind of where we start thinking about it. These aren't absolutes. This is just a rough guide. There's a lot of exceptions to that rule, but it gives you a ballpark idea. Now, on the flip side, if somebody's already had a 10-pound kid, I don't care if the baby's 10 pounds this time or not, because obviously she can do it. But 10 pounds is a good place to at least think about it and start that conversation. Okay, that was good. Thanks everybody for being on the stream with me. Thanks for all your questions. That was we had a good response. Tons of questions. They were all good. Thanks to everybody. Tend to do these kind of Friday afternoons, maybe next Friday, not sure. But if you're subscribed and you get notifications, it'll tell you when I go live so you don't miss it. But generally kind of Friday afternoons here in Utah time. All right. Thanks, everybody. Have a good night. Have a good day. Have a good weekend. See you next time. Finish. There we go. Yay. I'm not sideways.